And I know you mentioned when we first got started, one of the reasons you got into it was like due to the misinformation and stigmas a lot of people with diabetes have to deal with. What are some common, misinformation tropes you see within, the diabetic community? Like, what are some things that you have to put your hand up and say, that's not true at all? Let's reset expectations about what's going on.
My biggest one forever and always is going to be, especially in the type 2 world, is going to be that like you did this to yourself. This is preventable 100%, that kind of vibe. Type 1, thankfully, is a little bit less likely to get that kind of stigma. Although there still are instances where people feel like, you did this somehow to yourself. But especially with my type 2 patients, I see that a lot, and it's just so wrong, and it gets internalized, and it just makes your life a lot harder when you're feeling that way too. And it's almost liberating when you find out that it's like not your fault, and there, it sucks to know that there wasn't maybe a lot you could do about it, but also like, you got to be gentle with yourself. And so yeah, that's my biggest one. Majority, there's just so many different factors that go into any type of diabetes diagnosis. It's never ever been anybody's fault, and a lot of the times could not really be prevented. So that's my biggest one. But of course, there's a ton of misinformation for all types of diabetes about diet, especially like, do I have to cut out multiple food groups? I'm not allowed to have carbs. I'm not allowed to have sugar or enjoy my life anymore. So those are things I spend a lot of time talking. It's interesting. I talk people down a lot. So people often come to me. I thought I would be maybe working with people in a way where I'm like trying to promote more health supportive behaviors. And I actually find that I'm trying to talk people down from some of the things they're doing. So they, maybe they cut out all carbohydrates, they're intermittent fasting, and things like that. And I'm like, if you're okay doing that, that's cool, but it's also not necessary. So it's
Yeah.
just kind of this thing that's attached to diabetes that we see in the media and all of it, and our doctors often tell us to do as well. So yeah, definitely there's a lot of that diet culture, and then also just where diabetes comes from and the pathophysiology of it.
It's almost like you have to deprogram people because they've just, gotten so
Yeah.
much secondhand information online from like fitness influencers and everything like that.
Hmm.
They're like, oh, I got to do this, I got to do that. And it's funny because like I'm big into fitness myself, and I see a lot of these fitness influencers, and I'm like, those guys are eating oats, those guys are eating pancakes, those guys
Yes.
are eating sugar, and they're running like 20 miles. So this whole idea that you can't eat carbs or sugar, like it just doesn't hold up in any sense, right? Like,
Hmm.